Hey folks, Jay here from the BCIR Advocate. Today we're going to talk about pouchitis. What is pouchitis? Briefly, I'm going to chat about what it is, what pouchitis feels like, how do you treat it, and just bring some awareness to probably the number one annoyance you might experience with the BCIR. So if you've had your first bout of pouchitis, you'll probably definitely know what I'm talking about, or maybe you're still considering the BCIR and wondering what the heck this word pouchitis is. I used to get pouchitis maybe 3 times a year in the early years, right after the BCIR surgery. Then it was down to once a year. Now, after living with BCIR for over 13 years, I haven't had pouchitis in several years now. I believe the BCIR just kind of needs time to fully adapt for your body to work with its new plumbing. So pouchitis, a quick definition, is inflammation in the lining of the BCIR pouch. It's actually pretty common to get pouchitis and experience all its joys. Symptoms include abdominal pain, cramps, increased number of bowel movements, watery, clear stool, lots of bloating and gas, and just a noisy gut. You'll just a lot of activity down there, and just a lot of gas, a lot of movement, a lot of gurgling. The experts say that because the intestinal lining that was once used for absorption, which was the small intestine, which was converted into the pouch, a portion of it, I should say, is now converted to a stool storage and is prone to inflammation. Basically, because the immune system is confused now, in a sense, because at one point it was used for absorption, and now it's been converted into storage for your stool. I guess it takes a few years for the body to kind of realize its new anatomy with the BCIR procedure, and then just to accept it. And that's why I think in the beginning you're more likely to get pouchitis, and then as the years go by, you're less likely as the body adapts. One practice to prevent BCIR pouchitis is to irrigate often. If the BCIR pouch is kept clean, there's a chance no pouchitis can develop. You don't want it to be stagnant in there, so you just constantly want to clean it. At least once a day, maybe even twice a day. Some have good results taking probiotics. Maybe ask the doctor about that. What types of these you can take to stave off pouchitis, so it doesn't form. So it's easy to know if you have pouchitis. By the 3rd day, you can be doubled over in pain. It's a pain that will feel like it's your entire abdomen and just a sickly feeling in your gut. It's pretty. It's an acute pain, I would describe it. Expect many trips to the bathroom that only slightly relieve the pain. You go, and then it feels a little bit better, but within 20 minutes, it seems to be right back to where it was. Gas seems to develop quickly, and that pressure in the BCIR pouch just intensifies the pain. The best way to treat BCIR pouchitis is to learn the signs and treat it before you get to that 3rd day, or just you don't want to let it go. When I first got out of the hospital, I think I went maybe a month with pouchitis, believing my pain was just the BCIR pouch stretching as it was still new. I just felt this. So basically a growing pain in the BCIR. I couldn't stand straight. I was just in so much pain. Realizing I wasn't going to be able to tough this out, I finally called the doc, who got me on some antibiotics to treat the pouchitis. He immediately knew what it was. It cleared up in about 3 days with almost immediate relief after the first dose. So the trick is to take note when you have some of these symptoms and call the doc before you let it go too long. BCIR pouchitis might be something to experience after your BCIR procedure, and hopefully in time it will fade, as it did for me. Just remember to call your doc as soon as you have any strange pains or symptoms. It might be pouchitis, and if caught soon enough, it won't really be a big deal. Well, thanks for listening, and if you want to ask me more questions about this topic or something new, just visit me at bciradvocate.com. I appreciate it very much. Thanks, folks.